If you suffer from CRPS or complex regional pain syndrome, and you've been told that there is no cure, this is the rest of your life, your solutions are ketamine, drugs, opioids, spinal cord stimulators, and this is not something that is curable, you have been lied to. I want you to leave this webinar today with a sense of hope. Complex regional pain syndrome is like a devastating tornado that takes down everything in your life. It destroys everything in its path. I do not think that it is normal to live every day in excruciating pain. And I think it is wrong for anyone, doctors, someone in your life, anyone in the CRPS community to tell you that there is no help for you. I have seen hundreds of patients go into remission, and my purpose today is to provide you with a sense of real hope that you can also recover. Let's first talk about what CRPS is. You have an injury, and instead of feeling better after the injury, so let's just say you fractured your foot, and you expect to start feeling better day 2, 3, 4, 5 after the injury, but instead of feeling better, your pain is getting worse. I'm talking maybe even worse than the fracture. Your skin cannot be touched. Maybe it turns red, maybe it's shiny, you can have swelling. That, in a nutshell, is complex regional pain syndrome. It's very unknown syndrome that very few unlucky people have heard about before they themselves started suffering from it. The traditional viewpoint is that a patient is healthy and normal, and then they suffer some kind of injury, and now they have CRPS. It is a lifetime condition. There is no cure, and the treatments available are Calmar, pain medication, physical therapy, spinal cord stimulators. The problem is those treatments are all Band-Aids. What do I mean? Band-Aid treatments don't work because they do not address the underlying cause. And that's why most medical doctors today and science as it stands still believe that there is no cure for that condition because all these treatments do not look at the cause. Why did you get CRPS? I'm sure you've asked yourself so many times. And has anyone ever given you a good reason? I'm going to attempt to explain that to you today. You are never going to reach remission if you treat the pain. The pain is something that came eventually. The pain is a symptom. The pain is not the cause. So what is the cause? It is a neurologic disintegration, meaning your central nervous system has been affected and it is not working correctly. That includes your brain. And that is the master control system that controls your entire body. And that is where the healing needs to start. I often use an example of a kitchen with a leaking gas stove, small leak. So you don't smell it, you go in the kitchen and it's leaking, but it's just a little bit. Over time, that gas is going to build up. One day, when you light a match, the whole kitchen goes up in flames. That is what happens when you get CRPS. Most patients will blame the injury. They'll say, if only I didn't have that surgery. If only I didn't have that fracture. If only that surgeon didn't hurt me and did the surgery properly, this wouldn't have happened to me. But I'm here to tell you, after seeing thousands of complex regional pain syndrome patients, that was the match. That was not the origin of the syndrome. It was just the thing that finally pushed you over the tipping point, and then you became symptomatic. Our approach is to treat the cause and to make you bulletproof so that you never have to worry about CRPS returning after you are in remission. CRPS is not a pain condition. Always remember that. It is a neurological condition. And until you treat it like a neurological condition, you're just not going to get better. You're going to always just manage the pain. I often put myself in the shoes of a CRPS patient. It affects so many things in your life. It is excruciating pain. So yes, certainly, pain is one of the top ways in which it affects patients, and it affects your quality of life. But most doctors don't understand that there are so many other symptoms that get bundled together with CRPS, or should be bundled together as one big condition, not separate conditions. So for example, I would say 80% of our patients also have GI dysfunction. So, that could look like nausea, cannot digest food, cannot use the bathroom, cannot eat anymore, needing a feeding tube, your digestion slows down. Lots of CRPS patients also have a condition called POTS, postural orthostatic tachycardia syndrome, where if you stand up suddenly, you get super dizzy. You could just pass out at the drop of a hat. You may feel lightheaded all the time. Or mast cell activation syndrome, which is basically a condition where you become allergic to everything. I've even seen patients become allergic to things like water, which is obviously a big problem. In medicine, they like to piecemeal these symptoms out. So it's kind of like taking your car to a mechanic, and then the mechanic says, well, I don't know if it's your water pump or your air filter. Let's go in and see if it's your alternator. So they go in and they treat it like parts. But your body is not a car. It's not designed as all these parts, where one thing doesn't affect the other. Everything works together. You're a whole human being, and all these parts connect. So if the central nervous system, that is your master control system, breaks down, it's going to cause other symptoms. Where people go wrong is that they symptom chase. They want the pain to go away, so they take painkillers. They don't want to have GI dysfunction, so they get medications for that. Maybe they get feeding tubes. They get treatments for MCAS. But you're still treating the symptoms, not the cause. So you now may have a question, which is, what's wrong with my nervous system? If that's what's causing everything, why? Why is my nervous system broken and not someone else's? So many people live normal lives and have injuries and they recover, but I didn't. The reason is because your kitchen was filled with gas. Let's just get back to that gas stove example. What is the gas? What went wrong in your body? I have treated CRPS patients since 2010 now, and that has given us as a team a wealth of information that I feel that no one else has really dug into. As a CRPS patient, you probably feel like an odd man out. You're that one patient, the zebra patient, or the unicorn patient, where doctors just have never seen a case like yours, and yours is the worst, and you have all these symptoms, and you're so much sicker than other people, and you go from doctor to doctor to doctor to doctor, and they're doing the wrong things, and the treatments, you've tried so many treatments for so long, you've spent so much time and money, and you've gotten your hope up only to have it dashed. Why didn't that work? Because all of those treatments, we're attempting to just make the pain go away. It never asked the question or never looked at what went wrong. We have noticed that I would say at least 70% of our CRPS patient population suffer from a condition called Ehlers-Danlos syndrome. So not to overwhelm you, because you may think, oh boy, that's all I need is another diagnosis. I want you to rest assured that EDS is a condition that, yes, it can be very serious. It can be very mild. It's a gray scale. It is suspected to be a genetic condition. There are many types. They've identified genetic markers for some of them, but the most common kind, called HEDS or hypermobile Ehlers-Danlos syndrome, they have not found the genetic link. We suspect, strongly suspect, it is genetic because it tends to run in families. Parents, children, or siblings, or aunts and uncles, but we do see that it runs in families. EDS is a condition, and I'm oversimplifying here, so forgive me, but it affects the connective tissue in the body. It also affects the GI tract, much like CRPS, and in ways that we do not yet understand, but I believe one day we will. It affects your immune system and your central nervous system. The central nervous system is the computer that tells the immune system what to do. So if you're exposed to a virus like mononucleosis, you will get sick, and then the virus, instead of the immune system killing it dead, it just kind of wounds it. It's hanging around in the background, and it's still there behind the scenes in your body, constantly affecting a nerve. That nerve is called the vagus nerve. In Latin, it means the wandering nerve. It's a nerve that comes from your brainstem. Think of it as tree roots, a tree with many, many roots. Those roots, those branches connect to all your internal organs, your bladder, your reproductive organs, your GI tract, your lungs, your heart. And the most important thing about that nerve, it controls neurologic inflammation or your immune response. So the vagus nerve very much is one of the top captains that tell your immune system what to do. So instead of killing this infection dead, it's not doing its job properly, and it's in the background causing the gas stove to leak, or this neuroinflammation. And then one day, if you have an injury that now pushes the inflammation past this critical line, you get CRPS, and you're eventually diagnosed with complex regional pain syndrome. So let's just circle back to this whole EDS thing. How do you not know that you have it? Were you born with this genetic condition and you're walking around with it, and you still maybe today listening to this, you're like, I don't know if I have EDS. How did they miss it? Think of EDS as a gray scale. You can have very mild symptoms, hardly any symptoms at all, or it can be quite severe. It can get worse. So there is something I refer to as genetic expression, meaning you could have bad genes or bad genetic short straw that you drew. Think of it as a Pandora's box. You know the legend of Pandora's box, where Pandora's box was locked up with all these sins, and then it was unlocked and it entered the world. Think of your symptoms as being locked in a box, and there's a chain around it. But every time you have an emotional stress, or you get sick, or you eat bad food, or you're exposed to mold or viruses, you have a tool and you're just chipping away at that chain. And then one day the chain breaks and the box opens and all your symptoms are expressed, meaning all of a sudden you become symptomatic. That is kind of how EDS works, and it is very much a risk factor for conditions like CRPS and also long COVID, to name just a few. Now, there are certain clues that will tell you that you may have EDS. GI dysfunction is certainly one of it. Your immune system is probably going to be more fragile than other people. So if you get an infection, you're just going to get more sick. You're not going to fight off bacteria or viruses as well as other people. You just seem to get everything. If your child comes home sick or a family member or loved one, you're probably going to get it. So your immune system is not very strong. There are other clues. So a common misconception, and this is definitely something you're going to find if you go Google EDS, is that people are all hypermobile, meaning you can bend down and, you're double jointed maybe, and your skin is looser than other people's skin. But I have found that not to be true. Many people are not hypermobile, and they're doing a lot of research right now about this because there are so many common misconceptions about EDS. But lots of patients that suffer from EDS as a child will be attracted to certain sports or athletics, like gymnastics is a very common one, cheerleading, dancing is another common one. They tend to be very graceful and limber, even if they don't notice hypermobility. So that is a common characteristic that we see in our patients. Again, I just want to acknowledge that you may feel overwhelmed. If I now say, what if I have this other condition now, another label to worry about? I'm going to cover this in detail, but remember, that is just another manifestation or symptom of the central nervous system not working well. It causes EDS symptoms and then also causes CRPS. So I'm not meaning to overwhelm you or give you another label. I'm trying to help you understand how to treat it, how to reverse it, and understanding that EDS may be a part of that puzzle will help you to understand and treat it better so that you may obtain remission in the end. Let's talk a little bit about this journey that you've been on, that I'm sure has been a nightmare in many ways. But a part of that nightmare is that you go from doctor to doctor to doctor to doctor to doctor to find a solution. And you haven't found it, and you're still in pain, and the solutions that they can offer you are temporary, focused on the pain. It can be terribly dangerous, like spinal cord stimulators, or invasive. Why is that? Why don't doctors understand that aspect of it? The first thing I want you to understand is that, yes, CRPS has affected you, but it is still incredibly rare. It is considered to be a rare disease. Most doctors, especially everyday doctors that don't specialize, will only see a few cases in their lifetime. There are hundreds and hundreds of thousands of conditions, and we cannot expect every doctor post-schooling to understand fully the intricacies of those conditions and how it works. If your car needs to run better and it's not, you can take it to a tire shop, and those people are not going to check your engine timing. They're just going to change your tires, look for holes, see if the tread is worn through, if you need new tires, balance your tires. That is what they're going to do. Then you may go to another person to detail your car, and another person to change the oil. That's kind of how medicine works. There is a joke that specialists know more and more about less and less. And I feel that is part of what's wrong with healthcare in the US. You've got specialists, each focusing on their area, and they're also trained in an allopathic system where very much we're looking for a diagnosis, to pinpoint that diagnosis, and then once you have that diagnosis, there's either a tool, and the medical tool is typically medication, spinal cord stimulator, ketamine, it's symptom-centered. They're not looking at the cause. Look, I have a lot of respect for medicine and medical doctors. I've treated many medical doctors. I employ several nurse practitioners. Thank God, if you're in a horrible car accident, you can take your broken body to the emergency room, to ICU. They have a machine that can breathe for you. They can sew you up. They can fix your organs in surgery. They can put metal in your body if your body cannot heal broken bones. That is incredible. We have some of the best healthcare in this country. Where we go wrong outside of emergency healthcare is when we're trying to manage chronic pain and we're treating that as the problem, and no one's asking, what's causing the pain? Why is this patient in pain to begin with? What got them to this point? And unless you reverse engineer and try to figure out how you got sick in the first place, you're never going to enter full, robust remission. So now that you understand that CRPS is not a pain condition, and it didn't happen in one event, it wasn't one thing that went wrong that caused you to have it, it should make it clear to you that treating the root cause is incredibly important if you're ever going to recover. And in order to treat it, you have to treat the central nervous system. Why? Why do we treat the central nervous system? We don't think about it that much. It is the master control system that runs every single thing in your body. It controls healing, controls inflammation, it controls digestion, and it is also responsible for pain or lack thereof. So if we can go back to that control system and change it, it will change everything for you. That is how you are going to recover. I used the tire example earlier. You take your car to a mechanic or you're going to clean it. What if you had a pit crew working on your car? A dedicated team of people that have done this hundreds and thousands of times, and they know exactly what their purpose is, and they have a small piece of the puzzle, but that pit crew works together as a team. That's a big frustration I see with patients. I go see a doctor, I have to go through my entire history. Sometimes they believe me, sometimes they don't. Sometimes they've heard of CRPS, sometimes they haven't. But I have to explain my history over and over. It's so bad that most patients will come in just with a document typed, giving it to the doctor. And the sad thing is if a patient walks in and they have a history this thick, doctors just kind of dread that visit because they think it's going to be complicated. And yeah, your condition is very complicated. Then you go to the next doctor, but the next doctor never spoke to the first doctor. So there's very little communication between your team members. It is very important that that team, that pit crew working on your body, all communicate with each other. It's also important that they communicate to each other a lot, because from week to week, anything can change. So the person working on your brain and the person working on, let's say, your CRPS foot, both of them need to communicate with each other so that as a team, they can address every single aspect of what went wrong with your body and got you in this position in the first place. And that, in a nutshell, is why I developed my program the way that I did. It was incredibly important to me that certain aspects were incorporated into that program. Number one, communication between team members. Number two, have a laser focus on healing the central nervous system so that it can heal your body from within. And not just the CRPS pain, but maybe you suffer from other conditions that you thought were separate: gastroparesis, brain fog, anxiety, depression, POTS, mast cell syndrome. The list goes on and on. All those things are connected, and if you can find that single thread, all of those can be reversed or very much managed so that it doesn't affect your life. The other aspects of the program was CRPS patients, as you know, have a hard time going through treatments because you're in so much pain. Sometimes you're in a wheelchair or bedridden. And if you do anything, let's just say you decide that you absolutely will go to your child's play because you don't want to miss it. So you're going to white knuckle it. You're going to go despite the pain. But then you pay a price for that, So anytime you exert yourself or anyone touches you, your pain goes up. It can take days or months to calm it back down. So there has to be this beautiful dance in any robust treatment program where you calm the nervous system, you keep it calm, and then you push the patient. Think of it as a fire. You kind of have to keep this fire going. You have to feed it. But you also have to keep a wet blanket on it so it doesn't get out of control. So the two go together. You've got to keep that inflammation down so the patients can go through the program and get better. It is incredibly important that you keep the parasympathetic nervous system activated throughout treatment. I want you to think of the parasympathetic nervous system as the brake in your car, and the sympathetic nervous system is the gas. Sympathetic nervous system speeds up everything, like your heart rate, your blood pressure goes up. It is something that's activated, let's say, if you're running. The parasympathetic nervous system controls digestion, healing, sleep, and it calms things. And those two, yin and yang, need to work together. Now, our program has at least 16 different therapies. And we do all of those typically over a 14-week period where you're just bombarded with one treatment after another. Think of it as a Mike Tyson punch out. You've got to punch it out and make sure the enemy is down, and it's going to stay down no matter what. You don't need the right doctor or a single cure that everybody seems to be waiting for. You need a team of experienced, dedicated, passionate individuals with a lot of experience that's going to support your body to heal from the inside out. You cannot fix a problem like CRPS from the outside in. It's going to have to heal inside of you. Your body has to do that. Your central nervous system has to do that. Hope is incredibly important in this process, and that is why it is so important to me that after this webinar today, you leave with, even if it's the tiniest fraction of hope, that is the crack in the dam wall that is going to break it all open, that lets the light in. I named my clinic Spero Clinic. Spero means hope in Latin. People that come in and can find that tiny sliver of hope has a solid foundation to build upon to eventually obtain remission. I know that it is possible. I have seen it hundreds of times. I have seen patients that have had CRPS for 45 years plus recover and go into remission, so that I know that your body can do it too. You are not too broken. You are not too far gone. It is not too bad. You are not too sick. I know that your body can do it. I've seen it too many times. My name is Dr. Katinka Vandermeer, and I am the founder and CEO of the Spero Clinic, and we've treated patients from more than 34 countries and all 50 states in the USA. And my sincere desire is for you to know that there is a very good possibility that with the right support, you can recover and get your life back the way it was supposed to be, not the broken life that you've been forced to live since you got CRPS.